Hello, my name is Dr. Chandni Nakum and this channel is dedicated to all things teeth and dentistry. I'm a dentist based in the UK and I enjoy making people smile, not only from the outside but also from within. The purpose of this channel is to help you to understand your teeth better, so I'm trying to make complex information into simple, bite-sized and an easy way to understand more about your teeth. Now today's video is one of the most common issues, and that is wisdom tooth ache. It is probably one of the most common things to experience, so we're talking about all things wisdom teeth. If that sounds good to you, please subscribe and hit the thumbs up. So let's get into it. Wisdom teeth. Wisdom teeth are the last teeth to come into our mouths. They usually come at around about the age of 17 to about 23, 24 years old. Now, because they are the last teeth to erupt, there sometimes just isn't enough space for them. So what can happen is they come into the mouth at lots of different angles. One angle in particular which can cause problems is when the wisdom tooth is angled towards the tooth in front of it. Now, what happens over time is that this area between the tooth in front and the wisdom tooth becomes really difficult to clean because the toothbrush can't get there anymore. So it not only causes problem for the wisdom tooth itself, but it also might be causing problems for the tooth in front of it because there are surfaces of that tooth that you can't reach anymore for general cleaning. The toothache that you usually get with wisdom teeth can also be because the wisdom tooth is erupting into the mouth. Now, overlying that is a flap of the gum. Sometimes when you are eating, food and other debris can get stuck between the wisdom tooth that's erupting and also the flap of gum that's overlying it, and this leads to inflammation. And the inflammation is what causes that area to hurt. So eventually there's a vicious cycle that's building up where you aren't cleaning it because it hurts, but it's hurting because there's inflammation, and it's not being cleaned because it hurts. So there's more and more inflammation that's being developed over time. So tip number one would be to keep it as clean as you can. I know that it will probably hurt a lot, but you are getting rid of the inflammation, so eventually it will stop hurting. You could even try things like saltwater mouth rinses. So you can make up half a cup of lukewarm water, you can stick a spoon of salt in it, and then gargle it in that area, which might help as well if you're finding it too painful to brush in that area. Tip number two would be to use a toothbrush with a small head. This just means that it makes it a lot easier to reach into the gaps where that wisdom tooth is, where a normal toothbrush wouldn't be able to reach. So this is often what I recommend. It's a single tufted toothbrush. As you can see, it's got a really small head, so it's able to get in the nooks and crannies around that wisdom tooth. Sometimes wisdom teeth can get infected, and when that happens, you're more likely to get swelling. This can be inside your mouth, but it can also show as your cheek feeling quite swollen. Now, if this happens, you must go to see your dentist. They might think that it's appropriate to give you antibiotics at the time, but it's important to get the swelling sorted out so that it doesn't get any worse, because it can have serious problems if it's left untreated. What do we do about wisdom teeth that are causing problems? Now, this is down to what the dentist thinks is most appropriate at the time. That's why it's a good idea to go and see your dentist if you are having issues with your wisdom teeth, because they'll be able to understand what's going on and the best mode of how to fix it. Sometimes with some wisdom teeth, they do just end up straightening once they're inside your mouth. And at that point, it's a good idea to just keep a watch on them and monitor them over a period of time. Sometimes though, if they are infected or if they have had a swelling in the past, or if you've had some serious pain with your wisdom tooth, then it means that the dentist may think that it's appropriate to have your wisdom tooth extracted. If that's the case, wisdom tooth extractions tend to be more complex than some of the other teeth in the mouth. The reason for that is because there is a nerve which runs along all of the side of your mouth towards the midline of your face, and it causes the nerve sensation to your tongue, to your cheek, to the teeth on that side. So when we're extracting a wisdom tooth, it's very dependent on the relationship and the proximity of the wisdom tooth to this nerve. If it looks quite close, then it's more likely that your dentist may refer you to have the tooth taken out, so that the whole procedure itself is a lot safer for you. What can happen sometimes is with wisdom teeth, because this nerve can be so close, it can cause nerve damage, and that's one of the complications and risk factors of having your tooth taken out. Again, this is something that your dentist will discuss with you, and any of the options that are available to you. If you've enjoyed this video, please subscribe and hit the thumbs up, and if there are any other videos that you would like me to make, please write this in the comment section below.